Do you have pain in the backside of your knee when you start to bend it? In this video, I'm going to go over how you can assess knee mobility as well as some exercises in order to improve it. Oftentimes, people are told to just stop what they're doing or rest in ice, and unfortunately, that's not getting to the root cause. Others are told to get an injection in order to help reduce some of the inflammation in the knee. And again, sometimes that works for maybe a week, but that's not actually getting to the root cause. A lot of times, that's just putting a Band-Aid on a bigger problem. Pain behind the knee can be multifactorial, but before we get in how can we improve this problem, let's go ahead and dive into a little bit what could be potentially going on and how we can assess this. So you have two meniscus that really sit in between the two bones there. As you bend your knee, that space is getting closer and closer, and so it could be irritating the meniscus. It doesn't necessarily mean that you have something internally wrong. It's just that the bones themselves are not gliding appropriately, and so it's causing some of that compression. A lot of times that doesn't necessarily mean that there's a meniscus injury, but the bones themselves, if the mobility is lacking, it causes some of the compression on those structures. So when we go into and we bend the knee, the two joints, the two bones, the femur and then the tibia are closing together, and it's causing decreased space behind the knee. If things are not moving appropriately and there's lack of mobility, it's just going to cause some of that compression. You are getting some of that knee pain behind your knee as you're going into a flexed position. I want you to try this out for an assessment. So take a towel roll, and what you're going to do is you're going to go ahead and roll it up. Okay? Now, what I want you to do is I want you to shove this towel right behind your knee, right in the knee crease. And then what you're going to do is you're just going to go ahead, go in this tabletop position. You're going to go ahead and rock back, butt to your heels. And you're just going to see if this alleviates any of the pressure or the pinching or the pain here. Now, if that's positive, we can use this as a way that we can turn this into an exercise to help open up the knee as we go into a flexed position. So what the towel roll is doing is it's applying some pressure as you go down on the two bones, which helps open up the space, okay? Again, if the meniscus is getting pinched as you go into a flexed position, this is a way that we can provide a traction to open up the joint space as you get into more knee flexion, which is super important because we want to make sure that we're not just pushing through that if it's really bothering you behind the knee, but we can use this simple little trick here as an assessment and then use it as an exercise as well. So the next exercise that I want you to try to work on this is going to be a knee carve. So what this is you're going to go ahead and you're going to sit down in this position here. We're going to take our one arm, bring it underneath our knee, okay? Now, you're going to take the other arm, you can just kind of lock it together like this so that we're providing as much stability as we can. Now, what I want you to feel for is this bone right here on the front of your shin. And I want you to try to just rotate your shin so that you actually feel this bump here rotating in and out. Okay, this tells me that we're actually getting our knee to rotate. If that doesn't rotate and it's just staying stiff and all we're doing is moving our ankle, that's no good. We don't want that. We actually want to see this knee rotate in and out. Okay, so if you're struggling with that, I would just start with working on this, and we're just rotating our knee in and out. A little bit more advanced is now I'm going to go through extending my knee as I rotate. So I'm going to start by rotating my knee outwards, and then I'm going to extend just to about 50%, and then I'm going to rotate it in and bring it back in. So here we're working on getting good rotation in through the shin. When it comes to knee pain, a lot of people struggle to get rotation through their shin. So the knee doesn't just straighten and bend, it also rotates. And so a lot of times people are super stiff into rotation, which again can cause some compression and pain in the backside of the knee. So what this is working on is we're working on mobility, trying to get this shin to actually rotate. And now the third one is we're going to be in this half kneeling position here, and I'm going to now take what we just did with the knee car and apply it into a loaded position. So I'm taking my hands here, I'm grabbing as high up into the knee crease as I can, and I'm turning my knee in as I come forward. Again, working on rotation as my knee bends. Rotating in is coupled with bending your knee, whereas rotating out is coupled with straightening your knee. So that is exactly what we're working on here, again, to help get the knee moving. Many people have been misdiagnosed or just simply told just stop what you're doing and not having a game plan of how to attack this problem. How do I know this? Because I'm Dr. Zack Atwood and I've helped over 1,000 people recover with knee pain with our one-on-one coaching program. So those 3 exercises should help calm the knee down. However, it shouldn't be the only part of your program. You should have functional mobility as well as progressive strengthening exercises to make sure that you're checking all the boxes to take care of this problem. Now, combining these with a structured program, this will allow you to get yourself into a lot of different positions to see how your knee can tolerate it, especially for whatever your goals are, whether that's getting into the gym or just day-to-day activities. We want to make sure that we challenge yourself and expose your knee to a lot of different positions without pain or limitation. Now, let's just say that these didn't improve your knee mobility or pain behind your knee at all. There might be something else going on, and these 3 exercises are not going to fix that root cause. So having a thorough assessment going through and figuring out what it is that is truly going on will allow you to have a plan for success. Our clients on average are seeing results within the first 30 days of getting out of pain and back to the things that they love doing. Now, going on Instagram or social media trying to find some exercises may provide you with some short-term relief, but that's not going to give you a good game plan to take care of this problem forever. So if you want a long-term fix for this, text the word knee pain to 248-814-2029 and let's tackle this together. People that are looking to get out of knee pain are currently texting me right now. So what's holding you back? So please like and subscribe to this channel if you're looking to improve mobility, improve your strength, and optimize your performance for long-term gain.